Hello friends, welcome to Lomedics. When we are a cute fetus in our mother's womb, our heart is beating and a communication is present between right atrium and left atrium, and also some kind of shunts are present in the fetal circulation. It is normal before delivery. If the condition is present after delivery, is it normal or abnormal? Abnormal. Then what is the condition is? Congenital heart disease. In this video, I am going to explain about the introduction, epidemiology, etiology, risk factors, cyanosis, classification, clinical features of congenital heart disease. Congenital heart disease introduction. Congenital. Congenital means defect at birth. Heart disease. There is a defect in the heart. That is congenital heart disease. It is the defect in the structure of heart or great vessels that is present at birth. Congenital heart disease is the lesion either alter the pathway of the blood circulation through the heart or obstruct the blood flow in the heart. Epidemiology. It is the major congenital anomaly. 6 to 8 infants are affected per 1000 live birth. 25% of them are severe life-threatening condition and they requires early intervention of congenital heart disease. Etiology. The etiology of congenital heart disease was unknown, and then poor nutrition status of pregnant women and obesity, genetic factors and environmental factors. These are the etiology of congenital heart disease. Environmental factor. If the mother have rubella infection, the fetus affected with congenital heart disease. Or if the mother take some kind of drugs like anticonvulsant drug, the fetus have the congenital heart disease. So the drugs are called teratogens. And maternal disease. The mother affected with some disease during pregnancy. Genetic factors, either chromosomal abnormality or gene mutation. If the baby have Down syndrome, Turner syndrome or Murphy syndrome, the fetus is affected with congenital heart disease also. Risk factors. Alcohol and tobacco consumption of the pregnant mother. Gestational diabetes, increase glucose level during pregnancy. Febrile illness, mother is affected with severe febrile, fever during first trimester of the pregnancy. It increases the risk of congenital heart disease. Rubella infection and lupus, that leads to complete heart block of the baby. And phenylketonuria, increase phenylalanine level in the urine. Vitamin deficiency, that increase the risk of congenital heart disease. Teratogens during first trimester, anticonvulsant drug, NSA drug, cotrimazole, thalidomide and retinoic acid. These are teratogens for the fetus that affect the fetus and it causes congenital heart disease in the fetus. Exposure to organic solvents also causes congenital heart disease like herbicides, pesticides, ionizing radiation. Classification of congenital heart disease. Before that, we should know what is cyanosis. Cyanosis is the bluish discoloration of skin and mucous membrane. Two types of cyanosis is present. One is central cyanosis, another one is peripheral cyanosis. Reason for the cyanosis is reduced hemoglobin level that exceeds 5 gram per deciliter in the capillary, that leads to cyanosis, or abnormal hemoglobin derivatives in blood vessels. They are leads to cyanosis. The site of the cyanosis is mucous membrane, earlobe, nail beds, cheeks, lips, tip of the nose. Classification of congenital heart disease. It may be acyanotic or cyanotic, they classify like this: acyanotic and cyanotic. Cyanotic is left to right side, which means left side of the heart, left atrium and left ventricle. The blood passes from left side to right side of the heart. So it increases the pulmonary blood flow. And another condition is obstruction to blood flow from ventricle. Obstruct the blood flow from ventricle. In cyanotic, the blood passes from right to left side. Right side, the deoxygenated blood is present. So the deoxygenated blood passes all over the body. The cyanotic heart disease is divided into decreased pulmonary blood flow and mixed blood flow. Decreased pulmonary blood flow means when the obstruction in the blood vessel, the pulmonary blood flow is decreased and blood is mixing. Acyanotic, left to right side. Increased pulmonary blood flow. Some conditions are increase the pulmonary blood flow. They are atrial septal defect, ASD, ventricular septal defect, VSD, patent ductus arteriosus, PDA, and obstruction to the blood flow from ventricle. Some conditions are obstruct the blood flow from the ventricle. They are coarctation of aorta, COA, pulmonary stenosis, PS, aortic stenosis, AS. Cyanotic heart disease. They are right to left side. Some conditions are decrease the pulmonary blood flow. They are TETROLOGY of FALLOT and TRICUSPID ATRESIA. In some condition, blood flow is mixing. They are transposition of great artery and TRUNCUS ARTERIOSUS. Atrial septal defect, ASD. ASD means abnormal communication between two atria due to defect in the interatrial septum. That is ASD. Defect in the atrial septum. Ventricular septal defect, VSD. Abnormal communication between two ventricles due to defect in the interventricular septum. That is VSD. Patent ductus arteriosus, PDA. PDA is the communication between pulmonary artery and aorta. That is patent ductus arteriosus. Coarctation of aorta. It is the narrowing or constriction in the portion of the aorta. Pulmonary stenosis. Pulmonary stenosis is the narrowing of the pulmonary valve. Aortic stenosis is the narrowing of aortic valve. Tetralogy of FALLOT. Tetralogy of FALLOT, it is also the cyanotic congenital heart disease. The patient presenting above 2 years, it is characterized by 4 conditions. Tetralogy of FALLOT. Tetra means 4. Mono means 1. Bi means 2. Tri means 3. Tetra means 4. 4 classical features are present. They are severe right ventricular outflow obstruction, right ventricular outflow obstruction, which means pulmonary stenosis. Large malaligned VSD. Large malaligned VSD. Large malaligned VSD, ventricular septal defect. Second condition. And overriding of aorta. Blood passes from right side to left side, supplied to all parts of the body. This is third. And right ventricular hypertrophy. That is fourth condition. 4 conditions are present in the tetralogy of FALLOT. Tricuspid atresia. The valve is not formed properly. That is tricuspid atresia. Transposition of great artery. The name itself gives the meaning. Transposition of great arteries. Great arteries, they are aorta and pulmonary trunk. Normally the aorta arises from left ventricle, right? But here the aorta arises from right side and the pulmonary trunk that is arises from left side. That is transposition of great artery. Truncus arteriosus. It is the connection between aorta and pulmonary artery. It is due to the defect in the development of the fetus heart. Clinical features of the congenital heart diseases. Rapid breathing, cyanosis, poor weight gain of the baby, tiredness of the baby. Overview of congenital heart disease. A cyanotic heart disease, that is left to right shunt. One is increase of blood flow. Another condition is obstruction to the blood flow from ventricle. Increased pulmonary blood flow are AST, atrial septal defect, VST, ventricular septal defect, PDA, patent ductus ARTERIOSUS, and obstruction of the blood flow from the ventricle is COARCTATION of aorta, pulmonary stenosis, and aortic stenosis. Cyanotic heart disease, that is right to left shunt. That is, one is decrease the pulmonary blood flow, another one is mixed blood flow. Decreased pulmonary blood flow is TETROLOGY of FALLOT, TOF, TRICUSPID, ATRESIA. They are decrease the pulmonary blood flow. Mixed blood flow in some condition. They are transposition of great artery, TGA, TRUNCUS, ARTERIOSUS. Question time. Atrial septal defect means abnormal communication between atria. Thalidomide is the teratogen. Tetralogy of FALLOT is the cyanotic heart disease. Thanks for watching.